And a lot of the unknowns have become knowns. And now it's 2 years later, and we're now learning how to live with COVID-19. As we slowly transition into living with COVID-19, changes would be made based on our epidemiological situation and also based on our vaccination status. So today we want to announce a few changes. Our first change is related to entry protocols. Grenada has been widely using antigen testing to diagnose COVID-19 to guide on quarantine and isolation measures, and also as a requirement for travel to the United States. We are here today to report that our entry protocol will now be accepting antigen testing within 24 hours of arrival to Grenada, and will continue, which is related to entry protocols. Grenada has been widely using antigen testing to diagnose COVID-19 to guide on quarantine and isolation measures, and also as a requirement for travel to the United States. We are here today to report that our entry protocol will now be accepting antigen testing within 24 hours of arrival to Grenada, and will continue with PCR testing within 72 hours of arrival. So that change will be antigen testing within 24 hours of arrival. I know this is a very good change for a lot of persons in the diaspora because PCR testing is very difficult to access, and it has been a problem. A lot of flights have been canceled as a result of inability to get results on time. Therefore, with this new testing, we expect that persons would be very happy, and we would have more arrivals coming to Grenada, persons on vacation and persons to visit their families. The next change we would like to make is that of contact tracing. Now, Grenada is currently in a state of community spread, meaning that the virus is in all the communities within Grenada, Carriacou, and Petite Martinique. So the virus is everywhere. As a result of this, we thought it necessary to have a stop on contact tracing measures, meaning that we no longer have to do registration on arrival at different establishments with your name, contact number. So basically what we're saying is that when you go to the supermarket, when you go to the restaurant, you no longer have to sign in. However, please note that we continue to do temperature checks and check in for vaccination status. So the contact tracing requirement will be stopped, and we just wanted the public to know that. I know a lot of persons have been asking about it. They wanted to know, why are we still doing it if we're not contact tracing? There's no need to contact trace anymore because we're in community spread. So this is one of the measures that we are going to be stopping. Regarding tourism, and as we say, tourism is everybody's business. Currently, there's a distinction between passengers or tourists coming to our country by air and coming via sea. So persons coming by air, they have the luxury of being able to access all of our attraction sites. They're able to visit all the different restaurants, go to the waterfalls. They're not in a bubble. However, our cruise ship tourists are confined to the bubble. So this is one of the areas that we thought, again, there's a little bit of discrimination. And we thought that, let us go forward. Let us, get back to our booming tourism, and let us have our visitors experience and enjoy all of our attraction sites, our restaurants, and basically life in Grenada. So we've decided that we no longer want to have any discrimination or distinction between the two. So for all tourists, whether you enter by sea or whether you enter by air, you are free to walk around and experience our attraction sites, our restaurants, and life in Grenada in general. On gatherings, I know persons again would want to ask about gatherings because we have a lot of things coming up. We have carnival, we have cricket, we have football. There's a number of activities coming up. And again, in the whole transition of living with COVID, we thought it necessary to set up a committee, a subcommittee, which will work on how do we address gatherings while we try to live in COVID-19 and live in pandemic. So this committee is tasked with coming up with recommendations for gatherings, particularly things like cricket, football, carnival activities. And I know this is something a lot of persons have concerns about, but by the end of this week, we will have recommendations with relation to the gatherings, how many persons would be allowed, what type of gatherings would be allowed, the capacity, and things related to that. Would it be vaccinated events? Would it be unvaccinated events? So these questions would be answered before the end of this week. So I just want you to bear with us, give us a few more days while we deliberate more on that topic, and we'll come back with you to give you an update on that. So that is relation to our gatherings. So as we transition to living in pandemic mode, we would like to thank all the members of our community who have allowed, or let's say who have adhered to the protocols and our call for vaccination. To those who have not done so far, we encourage you to help us as we try to return to normalcy, as we try to balance between lives and livelihoods. Let us remember that we are in a pandemic, and our levels of vaccination plays a significant role in us returning to normal life. So again, we just encourage everyone, let us get vaccinated. Let us follow the protocols, wear our masks properly, sanitize our hands, avoid large gatherings as far as is possible. And of course, we will speak about that by the end of this week. So we will give an update on the gatherings. But let us all work together to get back to normal life in Grenada, Carriacou, and Petit Martinique. Thank you.
Thank you very much, Dr. Taisha Donald. So we move on now to Ms. Hannah Julian St. Paul, the Permanent Secretary with responsibility for hospital and community health services. Good morning.
Good morning, Leslie, and thank you for having us. Minister Steele, CMO, good morning. Morning to your listening audience. The Ministry of Health is really pleased today to be giving you a status update as it relates to the implementation of our renal replacement services at the General Hospital. This initiative is one that has been taken on, I believe, since 2020 by our management team at hospital and within the ministry. COVID, as we hear every week, we're here to provide an update on our COVID response, our public health emergency. And this had delayed that initiative. However, it didn't stop us from continuing to work to ensure that this vital service area is one that we can really boast of achieving. The ministry is really pleased, as I said, to say that we have completed our infrastructure, which is the area that would hold the unit that will be prepared to offer the long-awaiting dialysis service. Our equipment has been installed, so all of our medical equipment has been installed, and our furnishing is currently being done because we want to ensure that our staff and the patient that's accessing this unit we provide a level of comfort to them. So that has been done. As it relates to our human resource for the management and operation of this unit, that has also been completed. We have our nephrologists, our nephrology nurses. We have our clinical staff, or what we call our biomedical team that was trained in servicing of the dialysis machines. All of that has been completed. Our nursing and medical staff also had ongoing training for the utilization of these machines. We have also identified one of our doctors to oversee that department as we open up to the public. We have established our operating standards for the management and the care of patients within that facility. And as a result, that facility is earmarked to be launched on the 10th of March. And that we chose the 10th of March because it's an important day for persons living with chronic non-communicable disease and what we call end-stage renal disease. That day is World Kidney Day, so we are going to have the launch in connection with the celebration of World Kidney Day. You may ask, we hear renal replacement services. What service we are expected to get at that facility? The unit will be offering a holistic approach to renal care. And one of the services that is going to be offered is renal health education, because we aim to prevent diseases, prevent complications from. We would prefer if we do not have to manage complications and be able to prevent. So the unit will be providing renal health education, nutrition consultation with a certified renal dietitian, nephrology clinic, training in peritoneal dialysis, and training and peritoneal dialysis has been a service that has been offered at our hospital since 2017. We also would be offering vascular surge service, and for those of us who are aware, in order for you to commence hemodialysis, you must have some preparation done, and that would be your vascular service. We also will be in the long term, and that is long term, we will be trying to offer pre-consultation for preparation of persons seeking to have kidney transplant. And currently we have one patient, and we are happy to say it's one of our staff who had the opportunity to have a kidney transplant in Guyana, and that was done in collaboration with our dear Minister Steele and the Health Minister in Guyana. That service was free of cost to our patient, and that would be one of our long-term goals. We have to continue our public awareness, and commencing this week, we will have our staff, our health promotion department, in connection with the nutrition department, commencing our health promotion programs as it relates to kidney disease, as it relates to renal care, and prevention of kidney or end-stage kidney disease. So these are some of the things that we have done so far. And you would ask how the service is going to be implemented. How are we going to do so? This is vital for us. We have to ensure that in order for us to have a smooth transition and for this service to be effective, we're going to be doing a phased approach. And that phased approach means that not every patient that now is being dialyzed would come over to a government system at once. So we will commence with 2 patients for 4 weeks. We would reassess, because remember, this is a new service and there is a lot of technicalities as it relates to dialysis. So we have to review after that 4-week period. We would add another 2 patients, and then we review, and it would be constant until we get to the maximum level at which we would like to go. The service will be provided every day of the week, Monday to Friday. We have a system in place for emergency response as well, and the service would run over with a 12-hour shift. One of the critical areas for persons that has kidney disease or presently accessing dialysis is affordability. And the objective of the Ministry of Health is to ensure that dialysis service is accessible and affordable. That is why we develop a cost or a fee structure for dialysis. So we looked at it in 3 tiers, or what we'll say 3 categories, right? So the first category we looked at is persons who are insured or has health insurance. These persons would be able to utilize their health insurance to access the service. The second tier looked at persons who are uninsured, but they can afford to pay out of pocket. So that's the second tier. And to ensure that we have equity in our service delivery, that means that everyone can access the service at an affordable rate, we have looked at the third tier, which looked at persons who benefit from the SEED program, persons who are unemployed, persons who may be earning less than $15,000 per month. So $1,500 per month. So we have developed a criteria to ensure that everyone can access that service. you may ask, what are the fees? And I would ask of you to allow me to provide that fee to you at a later date. Because as we know in everything, we have to make some amendment to the fees regulation legislation within our hospital services in order for us to be able to publish that fee. But I can assure you that everyone, the aim is that everyone will be able to access our service at the General Hospital. Another question you may pose is, what happened to the private entity that is currently providing that service? We are happy to say that over the years, that private entity and the Ministry of Health has worked together to ensure that our patients have access to care. And that relationship will continue. And maybe it would even bring us closer because they have been with us, supporting us because they have the level of experience for that sort of service, and they have been providing a lot of support to us for the implementation of that service. Also, the Kidney Foundation. The Kidney Foundation will be one of our closest partners because they are the ones who provide that emotional, psychological support to persons affected with kidney disease. So we are going to continue all of that relationship as we go forward to implement that service.
All right, thank you so much, PS Hannah, Julian, and Paul. A lot of information there from you. Thank you so much. We now go over to the Minister for Health and Social Security, the Honorable Nicholas Steele. Good morning, sir.
Good morning, Les, and good morning to all of our viewers and listeners there, out there. I want to start by saying if I wasn't wearing the mask, you would see the smile on my face and how proud we are with and happy to make this presentation today, both presentations. Let me start first with dialysis. It's been a dream of ours, and first and foremost, I want to mention the individuals who have been working on this, intimately involved, and thankfully, two of them are here in front of you. So Dr. Taisha Donnell as our medical director in the hospital, and P.S. Hannah and Paul. They've both are part of the team that that has made this a reality. But also here in Grenada, Dr. Carol McIntosh as our director of hospital services, and I think definitely Dr. Lisa Radix, a daughter of the soil, who has done so much and giving her time. And then at the top of that list is Dr. Bristol, who leads that charge from personal motivation. So I want to thank them, and I think they need to be recognized. The members of the Kidney Foundation as well, who have been part of our driving force, our support network, and who will continue to be our partners in this, and Island Health Services, who provide currently dialysis services on Island, and we look forward to continue to working with them as we move forward. Everybody is going to be involved in this. But I want to say, while we count our successes in being able to produce or have dialysis services available through the hospital or our public health system, I'm looking forward in the next week or two, at least putting a target for us as well, because as P.S. St. Paul has mentioned, we're looking between now and the first week of March to have our dialysis network up and running. I think also that we should be able to face the public between now and then as well, to speak to preventing people from getting onto dialysis. It's all well and good, and it's a significant achievement to have dialysis services available. But I think we also recognize, and you can see from the nods from both P.S. and Dr. Donnell, that is equally important to prevent our citizens from needing dialysis, and that is to intervene earlier lifestyle adjustments, and prevent persons. So we're looking forward to that, and the individuals will be back again. Looking forward to that, to us launching that, that intervention process, etc. Again, I'm beaming and smiling. We have been through so much, and we have pleaded and begged your cooperation, your sacrifice. We've all done it as a people, and to be here today to talk about an easing of tests requirements for entering Grenada, accepting a rapid antigen within 24 hours, as well as a PCR that we have had, the removal of contact tracing. The recognition that it matters not your mode of arrival into Grenada, that a visitor is a visitor. It speaks to the fact that we have together made our sacrifices and done what is necessary, and we're seeing the light at the end of the tunnel. And by all appearances, while we accept that COVID-19 is endemic, it's here with us, it's not going to go away, I think we also need to recognize that we as a people have learned to live with this. The committee, I'm looking forward to them coming back with their recommendations with respect to the size of gatherings, and I know many of us out there looking forward to what that says or speaks to our various festivities and who we are as a people and what we celebrate. So I'm looking forward to that. I want to take this opportunity, though, to recognize that while we are talking about these easements and better days, we are also saying that COVID-19 has not disappeared. It's not gone away. So we need to still keep fit. And going back to our early days, we have had numerous doctors. Remember Dr. Martin and Dr. Mitchell, who were here, George Mitchell, who spoke about what you eat as well. The vitamin C, drinking, whether it is just orange juice in the morning, or cherry juice. Find ways to maintain your vitamin intake. And all the way down to where we are now with a committee, and I really want to thank the members of that committee, but most importantly, I just want to single out the chairman of the committee today, but we will continue to thank and recognize all the other members. So Mr. Anthony Boson, Tony, who has been providing yeoman service as well on this. All of these people have traditionally recognized our healthcare frontline individuals, but there are others behind the scene. And it really is a pleasant opportunity to speak about easement of opportunities, to also recognize as well, and I think it is appropriate, that healthcare and public health is a lot more than just COVID-19. And to be able to say that the Ministry of Health and those who have been at the Ministry of Health throughout this pandemic have not just been focusing on the pandemic. While we have been doing a very good job of managing the pandemic, there are others who have been working not just on the pandemic. Because remember, our medical director is also involved in all the patients who are coming to the hospital. The same team that's involved in looking after the individuals at the general hospital has been also involved in getting dialysis up and running at the same time. So I think they deserve the recognition, and P.S. St. Paul and Dr. Donald, through you, can you please express the gratitude of the nation and the government for the work done by all who have been involved, and how proud we are of the two ladies and the team that stands behind them performing this job. Thank you again.
Thank you very much, Honorable Minister. Colleagues, you've heard from everyone at the head table. Are you ready with your questions? GBN, good morning. Go right ahead. GBN, good morning.
Yes, good morning. My first question, the panel would have highlighted the easing restrictions in terms of the antigen tests within 24 hours of arrival, as well as contact tracing regulations being removed, and tourists are now more allowed to walk freely and engage and participate in leisure activities at the different restaurants. So the question is there a need for the state of emergency, because there seems to be no longer an emergency?
I think that's a very appropriate question, and yeah, within the next week, that is also something that has to be discussed and decided, because yes, as you have recognized, if there are all of these easements, etc., and so then quite likely there isn't. So I look forward to the committee first discussing and deliberating that this week between now and Saturday, and then by the next sitting of cabinet also it being discussed. It's going to be a collective decision, and I think appropriately to reach out to our social partners as well and have that discussion with them and make sure that everybody is on board. But I think most definitely an appropriate discussion or contemplation to have.
You have another question, Gerard?
Yes, I do. In terms of the renal replacement services and also the dialysis unit, while the PS would have went on about what would be done, always maintenance has been an issue. We see machines break down over time. Is there adequate, or will there be adequate maintenance? People who could adequately service these machines to ensure the longevity and sustainability of this service for the Grenadian community in the future?
Gerard. Thank you for your question, and I want to assure you that in the presentation I would have alluded to our entire biomedical department being trained to operate these machines, to service these machines, and we also have a service contract with the supplier for these machines to ensure that we avoid some of the questions or concerns that you would have raised.
Thank you. Any other, Gerard? Or that's it for now?
That's it for now.
All right, thank you so much. Nancy McGuire, good morning.
Good morning. Good morning to everybody. I'm wondering, on the test results that we're doing pretty much daily, what are the test results telling us about the variants that are still here in the community spread? And on the subcommittee that's doing this work, can you tell us who is on the subcommittee that will be deciding on the size of gatherings? And on the dialysis machines, you're going to start out with 1 or 2 and then add another 2 after 4 weeks, if I understand it correctly. What is your ultimate goal in the number of patients that you will be able to service in those 3 different categories? Thank you very much.
I'll take the subcommittee, but Dr. Donald on the tests and so.
Okay, so thank you, Nancy, for that question. So regarding testing, of the sequencing that we've done so far, the majority of cases that we sequenced, we identified the Omicron variant. We did identify also the Delta, but it was just 1 case. But the predominating variant that we've seen with the test that has been done so far has been the Omicron variant.
Yeah, on the committee, the subcommittee comprises of Dr. George Mitchell, our Commissioner of Police, and Ms. Adele Garbett. So we've had Dr. George Mitchell from the public health standpoint, the Commissioner of Police from a law enforcement standpoint, and Mrs. Adele Garbett from a private sector standpoint to discuss the size of gatherings as we move forward, or to come back to the committee and then committee to cabinet.
Nancy, I just want to correct you. It's not 2 machines at a time. We have installed at our unit, we have 5 machines that are dialysis machines, and these 5 dialysis machines would be able to take us to a maximum capacity of 30 patients. The incremental approach is the patients being added, not machines.
And let me add, we also have other machines as backup that have not been installed but are there in reserve.
Thank you very much.
Yes,
Go ahead.
yes, I understood that. I was just trying to get to the number of patients that you would ultimately be able to provide service for. So we have 5 machines, and those are all at the general hospital?
Yes.
Okay, thank you.
Nancy, I thought you would ask why, when, or how are we going to put machines other places, and it is a challenge that we have accepted and we are looking at, but we need to have the primary site up and running fully, and the issue is not machines, but the issue is to make sure the quality observation and support, nephrology support to the patients. And that will dictate if and when we can move to St. Andrews, say, or Carriacou, to also offer dialysis services there.
Thank you very much, Nancy. Troy Gill, good morning.
Good morning. My first question is for Dr. Taisha Donald. Has it been confirmed which of the variants the individual who died has succumbed to, and are you able to disclose what was the condition and also the age and the sex of the individual? Also, my second question to, I believe, Ms. Dr. Taisha Donald. During the Christmas season, we normally would have observed that people are non-compliant with their medications and so forth. And so it has been anticipated that there is an increase or an influx of patients going to the general hospital afterward. Can you share with us if there has been an increase in the number of hospitalizations as a result? Thank you.
So thank you, Mr. Gill, for your question. So regarding the person who passed, it is a 69-year-old male. Of course, that person succumbed to COVID-related illness, COVID pneumonia, along with other underlying conditions. Whether we have identified a variant, no. So far, we have not been able to do the sequencing on that sample, so we do not have the variant for that case just yet. Regarding the Christmas and the influx of cases, yes, so basically you identified, and this is a general trend. So during the festive times, we generally have a spike in the number of admissions, and Christmas was no different. We've had an increase in the number of persons coming in with the NCDs, the non-communicable diseases, uncontrolled diabetes, hypertension, strokes, kidney disease. So we have had an increase, leading to our overcrowding at our general hospitals, all of our hospitals across the Tri-Island state. So yes, we have seen an increase in cases, particularly the non-communicable diseases, which continue to be a problem. And I notice is something Minister spoke about. It's very important that we do lifestyle changes, exercise, hydration, being compliant with your meds. As a matter of fact, there are cases that during festive seasons, family members sometimes, look at the hospital as let's say a daycare. So what happens is that medication sometimes is not given. Patients end up in hospital, and then the persons who are caring are free to socialize. And this is a trend we have seen over many years, and it continues to happen. So we want to implore again with our population the need to change our lifestyle. It's important, a healthy lifestyle. We need to exercise daily. We need to make sure that we are well hydrated. We need to try to prevent these diseases, because really and truly you can prevent a lot of them with lifestyle changes. And the thing is, even if you do develop the disease, it's important that you do proper compliance do your follow-up checks. Make sure you see a physician. There's nothing like a little sugar and a little pressure. There's nothing like that. It's not a little, it's a lot. So if you have these conditions, remember, it's nothing little about it. So you want to make sure that you do your follow-up, you do your checkups, you make sure you comply with your medication, because there's a tendency again. Today, my pressure is down today, so okay, well, it's low today, so I'm not going to take the medication. Tomorrow, it's low again, so I wouldn't take the medication today again. No, we can't do that. We have to make sure we comply with our meds, because the medications help to prevent some of these complications, including kidney disease, which is one of the diseases we're speaking about today with the whole dialysis services. So yes, there's been an increase, and I think we'd like you to help us in that whole promotion of healthy lifestyles. So we'd really call on the media to assist us in promoting healthy lifestyles to our population. Thank you.
Thank you. Any other question from you, Troy?
No, not at the moment.
Let me just add on what Dr. Donald has said, in that while we are all optimistic and glad to come here today to talk about the easement of restrictions, etc., COVID-19 is still a very serious communicable disease. Let us not forget that Dr. Donald also spoke about a death last night. What we are seeing is that while it remains a disease that has a level of mortality, we are saying that we can live with it. It doesn't mean that we can ignore it and not take it seriously. So there's still the need for vaccination. There's still the need for personal responsibility. But what we are discussing and contemplating as a government and as a people is whether there is the need for all of these restrictions that we don't have for the non-communicable diseases that we're speaking about. So as we move forward, COVID-19 is not going to disappear. People are, regrettably, because of the level of vaccination that we have, or low level of vaccination that we have, we are going to see people succumbing to the disease, regrettably. But we have to find that balance that I have consistently said here, between lives and livelihoods as we move forward.
Thank you. Linda Straker, good morning.
Good morning. Morning to Minister and the other members of the panel. I have a number of questions this morning. My first question has to do with the easing of the restrictions. We know the antigen tests and so forth. Is there consideration been given, or maybe I should put it, the unvaccinated persons, would they be allowed to engage in social activities such as dining out and other events, other social events? Because we know there is no need for contact tracing. With regard also to the easing, is the easing of those regulations, is it as a result of lobbying or advocacy from the tourism and entertainment sectors, which has been proven to be affected most by the pandemic? And with regard for the upcoming August festival, earlier in the year, we did got confirmation from SMC that there will be some aspects of carnival. Can the minister tell us whether or not, what type of aspect of carnival can we expect to see in a couple of months? And will there be a launch of carnival? Traditionally, it would have been launched between the end of April and May. What are the plans already in motion for our carnival 2022? I do have, but I'll stop here.
Linda, let me take the last question first and say that's what the committee is looking at. I don't want to preempt them, nor do I want to try and influence them by making any public statements or so. But we all, I said, Carnival is part of us. We've made that sacrifice, most of us, to not participate. Some of us have ignored, but the committee is discussing right now, and when they come forward, it will go to cabinet and it will come to the people as well for contemplation. Your other questions, Dr. Donald? Yeah, again, look, the easement of restrictions is very different to a ignoring of the risks. They're two different points. Easement of restrictions and ignoring of the risks. And I said before, the COVID-19 has not disappeared. COVID-19 is there with us, and we do need to contemplate. And I've also alluded to personal responsibility. So it is not a given, and there are two different issues. Contact tracing. Just remember, the establishments, in particular, if we look at hospitality sector, the tourism sector, our bars and restaurants, etc., they were contact tracing, taking information for contact tracing, but the only persons allowed to enter were fully vaccinated persons. So I do not see a removal of contact tracing requirements alluding to a change in who can enter establishments or functions. So most businesses in St. George's, not in the hospitality tourism sector, vaccinated and unvaccinated persons could enter, but they would have to give their names. Within the F&B or entertainment and restaurants, etc., only fully vaccinated persons could enter. That we're not speaking to. We're speaking to contact tracing. Linda, engaging with stakeholders, listening to stakeholders, understanding the sacrifice and pain of stakeholders. Yes, if that's what you're referring to as lobbying, but no, with respect to stakeholders influencing a public health decision, no. You've been with us on this since 2020, the first quarter of 2020. And we've made some difficult decisions. We've received criticism from and support from all sectors, and continue to receive support and criticism from various sectors. So any sector pushing for easement or so in their own benefit, it is our responsibility to look at that and see if it is possible. But the decisions on easement of or restrictions, etc., are based on where we are in the pandemic and not how loud the voices are on the other side for a call for easement or criticism. It is where we are in the pandemic, and you will see, not just here in Grenada, but worldwide, because this is a pandemic. So I think one testament to that we can say is that the decisions that we are making fall in line with the trends that you are seeing almost everywhere else in the world, because this is a global issue. This is a pandemic and not just a Grenada issue.
Colleagues, anybody else? Linda, I know you said you have other questions.
Yes, I do have other questions. Would Dr. Donald be able to tell us, from since 2020, like the minister just indicated, we would have had to make adjustment to our lives as a result of the pandemic. Now, we are traditionally into the dry season, and during the dry season, we have increasing allergies and other respiratory illnesses. Is Dr. Donald in a position to tell us what was the record look like for the past 2 years, having to deal with both with COVID, which is linked to the respiratory system, as well as to the traditional respiratory problem? How has been that data looking in terms of allergies and so persons who suffer from asthma? So has there been the constant influx of persons who are suffering from allergies as a result of the dry season, the weeds, the pollens, and so forth, as to compare with COVID? How has it balanced out? And my final question, which will be to the minister, is can he tell us as to what extent has COVID affected general health care, and how much of those resources was diverted in terms of having to cope with all the impact of COVID on the healthcare system.
So thank you, Linda, for your question. And of course, because of the COVID-19 pandemic, wearing of masks became public regulation. It's mandatory wearing of face mask. Now, the thing about respiratory illnesses, they're transmitted via your respiratory system. So because of that constant wearing of face mask, what would happen is transmission would decrease. You'd have a decrease in transmission because everyone is wearing masks, so all the little organisms and so would be trapped. And you're also protected from external factors in terms of your pollen and so, because of course we're wearing masks. So what we've noted is that in terms of respiratory illness, and I'm a pediatrician, so I could also speak to that, we have not seen a significant number of persons with respiratory illness based on the fact, of course, it's all related to the wearing of the face mask. So persons, we have some protection there, if we can call it that. So there's been a decrease, but we continue to have, but not as much as we would have seen, particularly, for example, in the flu season. So let's say between September and March, normally we see quite a number of patients with asthma, wheezing, bronchiolitis, these type of illnesses, bronchitis. But now, of course, we still see these cases, but not as much as we would have seen in the past because, of course, persons are being protected by wearing the face mask. So the face mask has really helped us in that sense. So we have not had to battle with so much with the traditional respiratory illnesses plus the COVID. The COVID ones were the ones predominating. But the wearing of face mask has impacted in terms of these numbers. All right, so I hope I answered your question.
With respect to the effects of COVID-19, it's been significant, not just here in Grenada, but let's speak specific to Grenada. How many times have I, as minister, or members of my team come here as the Ministry of Health? But the discussion has been COVID-19, and today, thankfully, because we are also speaking about easement and moving forward, we can come to you and talk about dialysis as well. We survived the wave last year, our Delta wave. But I'd be the first to admit, and Dr. Donald can tell you, we came very close, like most other nations, to collapsing, which was what we are trying to avoid always. It was a lot of pressure on the team, on the facilities, etc. We have seen other nations that have succumbed to, and we learned and we prepared and we bolstered and we put support where necessary, and we came through. We lost a lot of Grenadians unnecessarily, I think. Too many. And I see people still speaking to natural immunity. And the cost we are paying for that natural immunity, the amount of individuals that are now coming forward that have elevated pressure, higher levels of blood sugar, and the other triggers that we now have to begin to measure, like most other countries. And it's not a Grenada thing. This is a worldwide. That COVID-19 significantly leaving people with elevated levels of blood pressure, elevated sugar, lung restrictions, physical restrictions, ability to exercise, etc. Why would you choose that over the vaccine that has no side effects? So I still want to encourage, while we're easing and saying that we must learn to live with COVID-19, I truly do. I'm asking all of you out there to go speak to friends and family who either by accident or deliberately chose this natural immunity route of getting the disease, or did not come forward in time to get the vaccine. Speak to them. Don't listen to me. Speak to them and find out how that's working for them. How many individuals? And we really, really need to avoid this. I was heartened on Saturday at one of the sites, or vaccination sites, to see so many young people coming forward for their first dose. And we need more of that because we're saying COVID-19 hasn't disappeared. It's just our ability to live with it, but that doesn't mean that you can't get it and it won't have serious negative repercussions if you're unvaccinated.
Thank you very much, Minister. GBN, good morning. You have another question?
Yes, I do. A question, clarification. When does the protocols or changing regulation come into effect? Is it immediate? And as well as clarification, what is the status of Dr. Sean Charles? Last week, post-cab, I think Dr. Taisha Donald was introduced as the acting CMO. Was it in error, or is that a change that is developing?
So I'll answer the second question first. Now, remember, as we said, this has been 2 years in COVID-19 pandemic. Dr. Charles has been working throughout these 2 years, and really and truly, he's tired. So Dr. Charles is on vacation. Yes, so he's still with us, but he's on vacation to get some much needed rest. Okay?
With respect to the change in the various protocols, yes, the Attorney General's office has made those various adjustments already, which speak to the type of tests needed to enter, as well as the contact tracing and looking forward to the adjustments. Now, the adjustments with respect to 3-foot or 6-foot mandate have already been adjusted because, or to facilitate and accommodate our schools. And that's the other part. I think let me spend just a couple seconds on that. In that Ministry of Health has said previously that there is no public health issue with bringing our kids back to school from a COVID standpoint. That is, there is a public health need to bring our kids back to school from the mental health of and education of our young Grenadians. So in order to facilitate that, the legislation that speaks to the 3-foot mandate has been adjusted as well, so that our schools, and certain schools have already, if not all. And I'm looking forward to that, our children being back to in-person teaching, being back to socializing and in the classrooms and being children and doing what children are supposed to do.
Nancy Maguire, you have another question?
Yes, thank you. The committee that's looking, or the subcommittee that's looking at the gathering size, would they be looking at any of the mask protocols? And do we have any more information on people that have long COVID? I know I'd asked about it before, and there was some indication that we'd be looking into that. And then I'm just curious, all these places that had these books of contact tracing, names, address, and numbers, what happens to all that document, all those documents? Thank you.
Nancy, the committee is guided by the issues of the day and discuss. So it depends on those various issues, and yes, quite likely over the next week or so, all of the various restrictions that have been brought in with respect to COVID-19 or to protect us from COVID-19 are going to be discussed and contemplated. There is a certain timing based on the science, based on the epidemiology, etc., that will dictate or will first facilitate what gets removed first or adjusted. We have kids back in the classroom. So the wearing of masks is one of those issues. So too is the size of gatherings. So I look forward to that continued discussion, and it will be contemplated and adjusted when appropriate, which is the same. We're being consistent. same with how we treat the cruise ships, etc. It's not about the demands or requests of individuals, but it is about the science here. We listen and we hear, and we will continue to find that balance between lives and livelihoods. Your other question. Oh, the names of those documents. I've seen certain establishments have collected that information and communicated with people in the same way that there's certain establishments, in order to get Wi-Fi, they will ask you to give them your phone number or your email address or so. But those contact tracing lists or so, I think establishments will continue to do what they've been doing so far. They destroy them after a certain period. The books, I'm not aware of any establishment keeping that list or so beyond the required period, which would have been the 10 or 14 days. When they complete a book, the book is destroyed. There's not going to be a mandate from government or the Ministry of Health to tell people what to do with that list. I think individuals are very much aware of the privacy of persons and the need or desire to communicate with patrons or customers and so on. We'll find that balance.
So Nancy, with regards to the long COVID, yes, we've had patients, come into access care at our accident and emergency and at our various clinics with long COVID syndrome. So yes, we are having patients with this condition. And again, it's another reason why we really encourage persons to get vaccinated, because of course, persons who are vaccinated tend to present with a milder form of the disease, and they are less likely to present with long COVID syndrome. But the persons that we are seeing with long COVID are generally the persons who would have had a more severe form of illness, and more so in the persons who are unvaccinated and who are hospitalized. So yes, we've been seeing a number of cases. I do not have the data on it at this point, but yes, we have been seeing these cases coming in.
Colleagues, we are at the 1 hour mark. Linda Streaker, I understand you have a final question. That will be the final question. Go right ahead.
Thank you very much, Les. My final question is actually to Dr. Donald. In her presentation, in her opening statement, she mentioned of persons who appears to be willfully having persons be admitted during the festive period. Is it that observers among older persons, or well as children who are sick with some one ailment or the other? Can you just share a little bit more on the persons who are affected by that? Is it also older person or children who have problems that would result in them becoming hospitalized, that they denied the medication 2-3 days in advance, knowing it will lead to them becoming hospitalized, so they stay there for the period? Expand on that a little bit more, please.
Yes. So, Linda, it happens across the board. So it happens with adults as well as with children. The good thing, as I said, the hospital is a safe place for the kids and for the adults, but it is a trend we've seen, and, it's not something that we should be proud of, but it is something that we have noted over the years. So it is across the board.
Thank you so very much, colleagues. So final words from you. I'll start with Dr. Tai, and then we'll come around to the minister.
So thank you, Leslie Ann. And again, as we transition into living with COVID, we're now getting into the endemic stage of the disease, and we want to encourage persons that healthy lifestyle is the key. Vaccination is the key. Remember that vaccination really does help to prevent severe illness. I always say, I've said to friends, I said, if I had any doubt about it before, right now, after what I've seen over the last 2 years, I am convinced that vaccination really does help. It helps to prevent severe illness. It helps to prevent hospitalizations. And we also want to ensure that persons live healthy. So healthy lifestyles help to prevent non-communicable diseases. It also helps to prevent persons from developing complications due to these illnesses if they go on to develop them. So if we maintain good lifestyle, if we are eventually diagnosed with an NCD, then it's important that we comply with our medications, our exercises, our follow-up checks. And generally, once you're controlled, you tend to do better. So I'm just imploring, we're now transitioning to living with COVID. Let us live healthy, let us get vaccinated, let us follow our protocols, and let us try to get back to normalcy in our tri-island state of Grenada, Carriacou, and Petit Martinique. Thank you.
Thank you very much, Dr. Taisha Donald. Ms. Hannah Julian St. Paul, final words.
Thank you, Leslie. As a ministry, we continue to implement our strategic goal. Despite our response to our public health emergencies, we continue the implementation of services in order to strengthen our health system. I would like to express thanks to our both ministers, Minister Steele and Minister Thomas, the management team within hospital services, our supportive partners for getting us to this point. We are really happy to be speaking of dialysis, the realization of our dialysis service today. We want to assure the general public that our healthcare system is in place, and our healthcare system, though challenged at times, continue to provide quality healthcare to our entire nation. We have seen it being tested in our public health response as it relates to COVID. We were tested, we were stretched, but we did not collapse. As a small island, I am proud at where we are at as it relates to our healthcare system, as we continue to do whatever it takes to ensure that we continue to strengthen that system and provide to the needs of our public. Thank you.
Thank you very much, Minister.
Yeah, let me say that again, speaking proudly about dialysis is a bittersweet moment. We're proud to be able to say that we are offering that service, but we have to recognize that the fact that service is so needed speaks to the need to have lifestyle adjustments and prevent people from getting onto that service. It's not something that we should be lining up to get. We should be lining up to get the vaccine, not lining up to get dialysis. Which brings us to the easement of the various COVID-19 restrictions. And let me say it because I'm seeing comments on social media already of persons asking, what does it mean? So when we say there's no contact tracing, that means that in no establishment is there the need to give your name or contact information. That's not necessary anymore from a public health standpoint. If an establishment chooses to ask for the names of the persons entering or so, that's for a different reason. That's not from today moving forward, not for a public health standpoint. With respect to what we're saying of cruise passengers, it means in the same way when somebody arrives fully vaccinated at Morris Bishop International Airport with a negative test, which up to today would be a negative PCR test, they are free to leave and go anywhere in Grenada. So too is a cruise ship passenger. So the issue of the restriction or only fully vaccinated persons at the cruise ship terminus is not a given there. The issue of the passenger coming off being able to go to the various establishments around St. George's or in Grenada, they are now free to do so once fully vaccinated, coming off of a ship that has been granted what's called pratique. In other words, that they don't have any other diseases or infections or so on the vessel. And the testing means that we've had numerous received information from individuals who have missed flights or so, because I have to say, many other countries are not as efficient as we have been here in being able to give you back a PCR test result within 24 hours. And Dr. Donald and her team need to get credit for that. In Grenada, you can get your PCR test results back 7 days a week within 24 hours. That is not the case in many states in the United States or the UK. And as such, persons have missed their flight, and we recognize this. And the fact that we're using rapid antigen tests here locally to make a determination as to whether you're COVID-19 positive or not, we feel we are able then to accept that as well as a pre-travel confirmation as to whether you're COVID-19 positive or not. So that's what those three significant changes mean. Dialysis, what does it mean? It means that the many Grenadians who have been sometimes only able to get 2 treatments a week and sometimes 1 treatment a week will now be able to have, let's say, a second service provider. IHS has been around for quite some time, providing a service of dialysis. Government has now gotten involved or thrown its hat into the ring, so to speak, and to ensure that all persons can get access. And so we're working with and not as a competitor to IHS, who have been in here before. So let me just close by saying that I want to thank those who continue to make the necessary sacrifices. We are in a period now where that call for sacrifice becomes less and less, or the number of sacrifices that we have to make because of COVID-19 are less and less. But let us not forget that many have paid a significant price, and some have paid the ultimate price from this disease. But let us recognize and focus on those who have paid a significant price as well. Persons who have lost their jobs, their sources of income. And as a responsible government and people, we are finding the ability, thankfully, through the leadership and the cooperation of the public, to pay a lot more attention to and to tip the scale onto livelihood and pushing forward and ensuring as best as possible livelihoods, which is what we would refer to as getting back to normal or the new norm. And I look forward to coming here consistently and seeing more and more of these restrictions and so are removed. But I don't want us to forget the fact that we have a low level of vaccination. It is possible for this virus to mutate again and us have to look at, but God forbid, or by the grace of God, that won't happen. So let's get vaccinated. Let's get back to normal as best as possible. Let's learn to live with COVID-19. Thank you.
Thank you so very much, Minister for Health and Social Security, the Honorable Nicholas Steele, the Acting Chief Medical Officer, Dr. Taisha Donald, and Ms. Hannah Julian St. Paul, Permanent Secretary with responsibility for hospital and community health services. And of course, thank you to all our colleagues who joined us via Zoom and asked their questions, our viewers on Channel 12, our Facebook page, YouTube, and those of you in the diaspora and the social media. So we've heard it, easement in restrictions, but we have to do our part. Still, we need to get vaccinated. And of course, we also heard all the good news about the renal replacement service at the General Hospital. Significant strides being made by the Ministry of Health and, of course, by the government, even as we continue to grapple with the challenges of COVID-19. So let us do our part to help the government and, of course, by extension, the Ministry of Health get vaccinated. And, of course, if you have a non-communicable disease, you need to ensure that you exercise, take the stairs instead of the elevator, do whatever you need to do to help out. We are all, as they always say, we are all in this together. So let's do our part. Thank you so much. Here's where we end for today. I'm Leslie Ann Johnson. Have a great day, everybody.